देश आणि रिलिजननुसार कशा सुतिका परिचर्याचं पालन यानुसार करतात हे हायलाईट केले त्यांनी. आता आपले नेक्स्ट स्पीकर इज Dr. Surjeet Kaur Bava. She is a founder of Ultra Slim Clinic and Medical Cosmetology Institute, Mumbai. Honorary Consultant, Department of Dermatology, Bharati Vidyapit, College of Ayurveda and Hospital, Pune. President, South Mumbai Maharashtra Ayurved Sammelan. Joint Secretary, Nima Dermatology Society. Pioneer in introducing penless laser hair reduction in India. Dr. Surjeet, she actively participates in the Ayush Ministry programs, and she is also a recipient of the prestigious Sushma Swaraj Award and winner of the Miss Beautiful Smile at India Brainy Beauty 2019. So I request ma'am to start her talk with a smile. Thank you.
So much, sir. That was a very generous introduction. यहाँ पर जो मेरे गुरु समान सीनियर्स हैं उन सबको मेरा प्रणाम, और मेरी सेम एज वालों को हेलो, और जो भी स्टूडेंट्स हैं उनको बहुत सारा प्यार. So with this we start our session. Yeah, next slide, ma'am. Motherhood is a very beautiful experience for every woman, but this experience should not cost her dearly. So for that, this topic is there, post-pregnancy Ayurveda cosmetology. We have had wonderful speakers who have thrown light on how Sutika Paricharya, Garbha Sanskar plays a role in the woman's life. So now, let us see what all problems a lady can face post-pregnancy and how can we handle it. Ma'am, next slide, yeah. So as we say that the health and beauty of human hair and skin is of immense psychological importance in our life. Although pregnancy is rewarding, as I said, Ayurveda promotes healthy lifestyle not only for normal human beings but also for pregnancy and post-pregnancy period. So, ma'am, next slide. So these are the commonly faced pregnancy issues by women. Mask of pregnancy, then there is loss of elasticity at the skin. There are acne and acne scars, hair fall and weight gain. Ma'am, next slide. Hair fall, yeah. So as we, in the previous slide, yeah. Weight gain, skin changes, sagging of breast. That is due to improper breastfeeding. Then sagging of abdominal skin. So Ayurveda has already advised Patta Bandhan in the Sutika Paricharya. Next slide, ma'am. Yeah. Labor is really stressful. Post-labor, as the woman is always thinking that how her post-pregnancy period will be, how will she handle labor, and all these things also adds to her stress. And also improper diet, which is not rich in nutrients, can lead to deficiency, giving rise to hair fall and improper care of hair. It's very sad nowadays women are drinking and smoking. They don't even think that they are pregnant. It's sad, and that is also adding to their skin changes and bad hair. So Khalitya, the best treatment is Shirobhyanga as advised by our acharyas. The importance of Shirobhyanga is very nicely explained in this slide. If you just see, after application of oil, when we give gentle strokes, oil reaches loam after 300 matra, and at the 900 matra it reaches majja dhatu. So that is how it is very soothing for the skin and also for mind. So the oils which we can recommend are Mahabhringraj, Yashti Madhu, Jata Maunsi and Brahmi. Now for Jata Maunsi, I have a special feedback of women that whenever we are applying oil to the scalp, they feel good. But with Jata Maunsi, the moment it touches, you feel relaxed. The next condition is chloasma, which is an acquired increased pigmentation on the cheeks, or we can say it's a mask of pregnancy. Next slide, ma'am. So how do we have approaches to the healthy skin? Abhyanga. is very important. We can add Varnya Dravya in the Abhyanga oil. These are few mentioned in the Granthas. Next slide, ma'am. So how are the post pregnancy or even during normal pregnancy, the basic skincare you should follow? Sun protection is really important, use of sunscreens. And we have to maintain skin hydration. Avoiding extrinsic factors, as I said, smoking and alcohol, pollution, stress, nutrition and diet restrictions, and alimentary supplementations. Women, they are avoiding nutritious food in pregnancy so that they should not have weight gain, but which is detrimental for the health of the fetus. Physical activities are very important and adequate sleep. Yeah. Topical agents, antioxidants, cell regulators, these are flooded in the market. Procedures like chemical peels, radio frequency, and there are certain injectable skin biostimulation and rejuvenation which can be done after pregnancy. Certain chemical peels are safe in pregnancy and some are not recommended. So one should be very careful about that. Skin hydration and moisturizing is important. Next slide, ma'am. So this is how we have treated this. If you see pigmentation, this is the post-treatment picture. Next slide. This is for the hair fall. Next slide, ma'am. Yeah. Next slide, ma'am. There are certain cosmetic procedures in the market which are going on. I feel that dermabrasion or microdermabrasion was very nicely explained in Ayurveda in Sushrut Samhita. I will just share the reference. Next slide, ma'am. Next slide. Next slide. Next slide. Yeah. So, as I said, microdermabrasion. Nowadays, we are using diamond skin polishing. So, we are using diamond tip for abrading the skin so that the skin, it works on fine lines, wrinkles, age spots, acne scarring, and melasma. Next slide, ma'am. Yeah, this is the reference which is there that they said ishtak, that is ईंट के जो particles होते हैं उसका घर्षण करते थे skin के ऊपर. So that was already mentioned in Ayurveda. Nowadays they are using certain growth factors. So how many of you know about the PRP going on? Yeah, you think PRP is good? Yes? Okay. PRP is actually, they are extracting your, first of all, they are taking your own blood, right? And after that, they are putting it into the centrifuge. And that plasma, they are again injecting, or they are applying on the skin. Is it US FDA recognized? Are you aware of this, students, doctors? No, it is not US FDA approved. They have said that it is safe, but it is not an approved procedure. So, what they have started doing is, in that PRP, they are adding these growth factor, these growth factors, they are adding into that. And again, they are injecting, which is not US FDA approved. Next slide. These are certain procedures like ultrasound. We can use our Ayurveda oils along with these procedures for wonderful results. Next slide, ma'am. Next slide. So these are certain cosmetic procedures which can be used for the sagging of skin or fine lines, wrinkles. Next slide, ma'am. As we said, Ayurved Prachan Karma. So nowadays they are using derma roller. It is giving good results for acne scars, और इसको गरीबों का लेज़र भी बोलते हैं. It's a wonderful equipment. Yes, ma'am. Next slide. Derma pen, again, a modified Prachan Karma. Next slide. Yeah, so Sutika Paricharya is very important for the psychological and physical well-being of the woman. Abhyanga, Ahar and Patta Bandhan are advised amongst the most important parameters for the best health of the lady. Next slide, ma'am. This is the Masanuma's, how she, yes, as Madhura ma'am has already mentioned some time back, that how it is important for the good health of the woman as well as the fetus. Next slide, ma'am. Yeah, Sutika Kal, as it says, that it begins soon after the expulsion of the placenta. Care should be taken, and in general, body massage, Ushnodak Parishek, Udar Patta Bandhan, oral medications of fats with medications, decoctions, and certain ahar has to be really important. Next slide, ma'am. Now, the most important is this. Yes. Stretch marks. Yeah. So, Balatel Abhyanga is explained in Sutika Paricharya, which is also mentioned in Sushrut, Vagbhat, and even massage of yoni is also recommended. Next slide, ma'am. So, action of Balatel, it is Vata Shamak. It cures all the disorders of the extremities. It actually gives bulk to all the muscles. Next slide, ma'am. Yeah. So, here, when we are using this oil, we can use with the certain technologies which I have mentioned some time back, that breast, especially nipples, if we massage with this Bala oil, it prevents sore and cracking of nipples, abdominal region. It helps in regulating the uterine muscles and stimulates oxytocin receptors, which helps in contraction of myometrium, and it stays in good shape. And also helps in proper drainage of the vaginal secretion. It pacifies apan vayu and tones up the vagina. Next slide, ma'am. Yeah. Next slide. Next slide. Okay, a human body can bear only up to 45 units of pain. Yet at the time of giving birth, mother feels up to 57 units of pain. This is similar to 20 bones getting fractured at one time. So, during the postnatal period, Bala oil helps in restoring that strength physically and mentally. So these are certain before and after pictures which we have treated at our clinic. Yeah. Next slide, ma'am. Yeah. So here we have done skin tightening with the RF. Next slide, ma'am. Yeah. Thank you. Anytime.
Thank you, ma'am. Now I request our honorable discussion to sum up the session in 2 to 3 minutes. Thank you.
Hello. Good morning, everyone. First of all, I would like to express my thanks towards the organizers for giving us the opportunity to share this session as a discussant. We have started the day with wonderful 3 presentations on ANC and PNC. I would like to congratulate all the 3 speakers for delivering such wonderful and knowledgeful lectures. All have explained the use of ancient wisdom of Ayurveda, Yoga, and the use of modern technology as well. So I appreciate the way they delivered us. And in short, जगाबरोबर जाण्यासाठी आपल्याला आयुर्वेदातील शाश्वत सिद्धांत जेव्हा मांडायचे असतील तेव्हा त्यांच्या भाषेत त्यांना समजून सांगण्याकरता आपल्याला मॉडर्न टेक्नॉलॉजी आणि रिसर्च याच्या बरोबरीने जायला हवं असं यांच्या तिघांच्याही लेक्चरमधनं आपल्याला वाटतं आपल्याला सगळ्यांना समजलं आहे. अँड इफ टाईम परमिट्स आय वुड लाईक टू ॲड सम पॉईंट्स अँड विल हॅव सम couple of question and answers with the speakers. First of all, Dr. Madhura Madam, I would like to congratulate again to explain the epigenetics and the Garbha Samskara in a very lucid manner. Have you published any paper, Madam, about the epigenetics and Garbha Samskar?
No.
Okay, because we are finding many papers on PubMed regarding the epigenetics and Garbha Samskar. Epigenetics modification, I would like to quote one paper. Epigenetics modifications such as DNA methylation can affect maternal health during the gestational period, they said. So, have you any So epigenetics is the your behavior or the environmental changes can affect the uh, genes, but they do not change the DNA sequence. Such Garbha Sanskar will have the the effect of epigenetics. Then time is less, so we are not having any question and answer sessions. Then I appreciate again the Sutika Paricharya, Sutika Katishul explained by Dr. Samir Gholab sir. Thank you, sir. You have explained it in the regional Sutika Paricharya also. In the Karnataka, Kerala and Maharashtra, I think you have sum up with these points. And I would like to add one thing again in the Sutika Paricharya, from my practice. When you are having the Sutika, you should ask the obstetric history in detail regarding the prolonged labor, obstetric labor and other things. And if the patient is having the history of Garbhasrava and Pata, that is the abortions, that also we have to take in our mind when we are treating the patient. काश्यप समितीमध्ये एक सूत्र आहे ते एक मला ॲड करावंसं वाटतं या ह्याच्यावर की जितक्या आठवड्याचा गर्भ आहे तितके दिवस सुतिका परिचर्या पाळावी अशा आधाराचं आपल्याला एक सूत्र सापडतं तर त्याच्यामध्ये इन शॉर्ट वेन वी आर हॅव्हिंग द पेशंट ऑफ गर्भस्राव अँड पाथ ऑफ 6 weeks or 7 weeks 8 weeks अर्ली trimester miscarriages, the woman of those women also required to follow the Sutika Paricharya. Not only the full-term deliveries, but the patients of abortions also they should follow the Sutika Paricharya. And in last, Dr. Surjeet Kaur Bava, madam, I appreciate the topic because the post-pregnancy Ayurveda cosmetology is a different topic and you have elaborated in a very well manner. Thank you so much for giving us the opportunity to share the session, chair the session as discussed. Thank you so much.
Namaskar. Today's all three eminent speakers, Dr. Samir Gholab, Dr. Madhura Kulkarni, Dr. Surjeet Bava,